Hello, my name is Danette Overstreet, and I'm so happy to be here with you tonight to speak to you about mental health issues in the elderly. The three issues I want to cover today are dementia, depression in the elderly, and ways to offer assistance. Life is all about changes. I like to call them life transitions. Just as we have different needs when we're young, as we get older, our needs change. Some of the life transitions we face as we're aging include retirement, and for some this can be considered a great loss. What to do with all this free time? Empty nest issues, adjustment to loss, such as the loss of a spouse, downsizing, relocation, moving in with family or to a more structured setting, and losing family and friends to death. What about loneliness? What if your phone never rings? What do you do if you're told you can't drive anymore? What if that back pain you've always managed to ignore becomes constant and severe? The medication you can take for it may be addicting and may cause you to feel drunk or fall frequently. The medications that the doctor has you taking may be too expensive because your retirement money just barely covers your bills. As surely as you continue to live, many changes take place. You have vision changes, sometimes hearing loss, sometimes the loss of ability to walk or take care of the house or even take care of yourself. Your ability to think, plan meals, pay bills may become overwhelming. What do you do? Where do you go for help? I know you've never had to ask for help from anyone for anything, and that asking for help is a very hard thing for you. But asking for help may mean the difference between living peacefully and happily into old age and quite the opposite. Now let's talk about family involvement. The senior adult has different needs than a younger person, and as a person continues to age and move through the stages of life, oftentimes help is required. This help can come most readily from family and friends. However, this need for help from others, any others, is often not welcome and may be even violently resisted. The person who needs help may not be aware of it, and even if he or she is aware of it, she may not want it. Family members may not recognize for a long time that there's a problem and may not know what to do, even when they can tell something's wrong. It is not easy to intrude into another person's life, especially knowing that your help is probably going to be resented. But you have to think of yourself as a paramedic, maybe that didn't get called, but is very much needed when they show up. There are many reasons why a senior adult may need help at this stage of life, but now I want to talk about dementia. First of all, there are several kinds of dementia. There's the one you hear so much about, Alzheimer's, but there's also vascular dementia, the kind that comes with damage to blood vessels in the brain, such as by multiple strokes. This can happen with small or large strokes. Then there's alcoholic dementia, and this comes from the brain being slowly poisoned over years of overindulging. It can come from drug abuse or traumatic brain injury. There's also medical causes of dementia such as Parkinson's or Huntington's. These kinds of dementia have things in common and also things that are particular to each kind. For the purposes of my discussion this evening and the time that I have been given, I will just call them all dementia. Your doctor can help you sort out what kind and what may have caused them when you see him. Long before the person with dementia comes to the attention of any medical caregivers and sometimes even their families, they are aware that something is not right. Their families may or may not recognize yet that something's wrong. This is usually not a quick process. It can be months or years before the person with dementia becomes unable to care for themselves. Here are some relatively invisible signs: intense suspicion and fear of others, outbursts of rage, often irrational, inability to follow through with projects, problems thinking thoughts through, depression, drastic changes in behavior, such as drinking bouts in a person who never drank before, inability to handle responsibility at work, in the community, or with family, curious inability to get a hold of ideas or thoughts, gaps of logic that cannot be filled no matter how often you explain them, responding with hostility for no apparent reason. The next stage is more visible, and this is called early stage warning signs. These can be, but are certainly not limited to, overall inability to function as well as before, deterioration in appearance, changes in grooming and dress, wearing slightly odd combinations of clothing, decline in personal hygiene, incapacity to deal with household bills, mail, or documents at all, dropping old friendships and social activities, becoming more dependent on others, or maybe avoiding contact with family and friends altogether, staying in bed for long periods of time for no apparent reason, becoming anxious or fearful for no apparent reason, telling stories about neighbors doing bad things, relating strange events, calling the police for no valid reason, having accidents at home, leaving pots on the stove, leaving appliances on, suddenly having the inability to use appliances or electronics, even the phone or the television, getting lost in the car, and having a series of unaccounted for car accidents, changes in sleep patterns, being unable to account for a day's activities, showing inconsistencies in mood or behavior, lack of food in the refrigerator or the cupboard, hoarding one kind of food, such as 18 cans of beans or 10 packs of cookies, or hiding food from other family members, mood changes that just don't seem to be related to what's going on. As you can see, this list is endless and very individualized. But these things indicate problems with thought processes and the gradual failure of the ability to manage emotions and to take care of oneself. It is hard for the person involved and for family members at this point to admit that something's wrong. This is called denial, and it is very common for people in crisis. Be assured that by the time you see these signs of distress, your loved one is dealing with a significant problem. At this point, a family meeting would be helpful. You all need to get together and discuss what is happening. It is important for families to have a reality check and make a list of problems. This is needed so that one or another family member does not feel left out or feel that mom is being railroaded. It is very helpful, but not likely, that all family will agree on what is needed. Even if your list of problems is similar to the one I just gave and the problems are serious, increased family support may be enough for a while. If you and your family can talk about what you need to do to help, your loved one's life may be able to go on as usual for a while. This may be setting up a shopping plan, a visiting plan, a meal schedule, or help with bills. Certain family members could take over certain household tasks. A pill minder box could be very helpful, with a family member filling it each week, managing the refills, patiently teaching your loved one how to use it and checking to see if the medicines are taken properly each week. A phone call or a card on the dining room table as a reminder can be very helpful.